you for the invitation. Thank you, Habib, for the invitation. Dear colleagues, it's a pleasure to be in this beautiful country again. We are going to talk about exosomes, and we start with the definition. So exosomes are extracellular vesicles running from 30 to 150 nanometers, shed into the extracellular space by cells. Those endocytic, that's important to know that they come from inside the cells. Those endocytic vesicles are originated by the fusion of multiple vesicular bodies with the plasma membrane. As they fuse with the plasma membrane, they have these double-layered lipid membrane vesicles. And that's very important because this is part of the action mechanism of action. The exosomes carry nucleic acids, proteins, lipids, and metabolites. They are mediators of near and long-distance intercellular communication in health and disease, and affect various aspects of cell biology, like regulation of gene and transcription, survival and proliferation, reproduction, angiogenesis and wound healing, waste management, host microbiome interaction, balance of immune response, apoptosis, cellular differentiation, and there is a lot of interactions with these microvesicles and the other cells. We must pay attention that they carry all the nucleic acids, lipids, but they also have these transmembrane proteins and the surface markers. And it's important because they can interact with the cells in two manners. Either they can work in a ligand receptor-induced intracellular signaling, or they can fuse with the membrane and deposit the contents of the exosome inside the cell. It's very interesting because we can also engineer these exosomes to load them with other molecules like chemotherapeutics, antibodies, and metabolites. So depends on what you want to do. As a pharmaceutical company, for example, you can put some substances in these small vesicles and make them to deliver, for example, a chemotherapeutic drug to a cell cancer. They can also be used for diagnosis because as they have the surface molecules, they have a kind of signature of the cells they came from. So you can use them to track the vesicles from some tumors. Which are the advantages of using exosomes derived from stem cells, specifically derived from stem cells? First of all, stem cell-derived exosomes are now thought to be largely responsible for the paracrine signaling process that leads to tissue repair. Also, the benefits of stem cells exosomes in regenerative medicine are similar to that of stem cells. However, many of the risks as cancer are mitigated. Because this therapy is cell-free, the risk is significantly lowered since the exosomes cannot replicate. Also, exosomes have a diminished immunogenic response, and given their smaller size and simplicity compared to cells, they are simpler to isolate and to preserve. So there are many advantages of using exosomes. I call them the magic vesicles because they can do a lot and they are more simple to obtain, to store, to infuse, and to apply. How do we obtain? Habib already told us. You have to have a source of cells. You qualify a doctor for harvesting the cells. Once you have the cells, either you digest or you obtain the explantation of that tissue. So we have a lot of cells that you identify using surface markers. Now you have the cells, and you know each cells. There are, for example, mesenchymal cells from the umbilical cord. Now the second step is you have to expand those cells. You have to have a large number of the cells. And nowadays what we do, as Habib showed, use bioreactor. Why? Not only because you can grow a larger number of cells, but because when the cells are in a 3D environment, they are happier, they are healthier, they produce healthier exosomes. So this is the standard nowadays to produce the exosomes. And finally, you have to separate the exosomes from the culture media. There are many ways to do it, and when you do it, you have to characterize. You have to be sure they are sterilized, and then you are ready to store and eventually send for medical application. Those are some of the methods. Each one has, as expected, advantages and limitations. The most common one is ultrafiltration. It separates the exosomes based on size and weight. It's easy, no need for special equipment, but it's time consuming and may not be suitable for blood samples, for example. On the opposite way, ultracentrifugation that relies on density and size differences as well is effective for large samples, but it has the potential to damage the exosomes. So it's very important to have this piece of information in your head in order you can choose the product you are going to apply to your patient. When Habib tells us about his lab with all he does, it looks like simple, but it's not. It's a lot of technology involved, and it's important to know from where your cells are coming or your exosomes are coming. I choose this example, diabetes, as an example for the treatment with exosomes because it's a very complicated disease and is a multi-target organs disease. So suppose you inject IV the exosomes, you are going to see the effects in all the target organs. For example, you see angiogenesis in islets, Langerhans islets, that aument the production of insulin. You aumment the insulin sensitivity in the periphery, cell apoptosis. You can enhance neuronal cell development and intraepidermal nephrophytes that modulates diabetic neuropathy. So it's such a complex disease, but these exosomes are able to target each organ and to immunomodulate the inflammation that is always present in diabetes. Of course, the exosomes are not used, are studied not only in the diabetes. They have been studied in chronic kidney disease, skin hyperpigmentation. In kidney disease, they are using umbilical cord exosomes. In skin hyperpigmentation, adipose-derived exosomes. In acute ischemic stroke, in transfected mesenchymal cells, exosomes. In Alzheimer, adipose tissue-derived exosomes, and in COVID, mesenchymal stem cells exosomes. So there are a lot of ongoing trials using exosomes from stem cells. Why from stem cells? Of course, because we want to use the regenerative potential of those cells. As a plastic surgeon, of course, I'm interested in skin rejuvenation. And some studies have shown that, first, the exosomes can penetrate the skin. And second, when they penetrate the skin, they go to the target cells, meaning endothelial cells, fibroblasts, and macrophages that are resident in the skin. So they produce angiogenesis, production of collagen, and they have a modulation of the inflammation. Another study by Kim and collaborators showed they studied the permeation of exosomes derived from umbilical cord mesenchymal cells, and studied the collagen synthesis on human skin. They use fluorescent green label exosomes, and they demonstrate that after 3 hours of topical use, the green exosomes could be seen in the outermost layer of the epidermis, and they continue to penetrate in the epidermis after 18 hours. More interesting, the application of the exosomes topically increased the expression of collagen 1 and elastin after 3 days of treatment on human skin. So the results show that umbilical cord exosomes are absorbed in human skin and promotes collagen 1 and elastin. That's huge, because this study shows that you can just apply the exosomes over the skin. Still another study on skin rejuvenation. These authors made a very well review and concluded that the exosomes from mesenchymal stem cells can induce regeneration of the epidermal skin barrier by increasing synthesis of ceramides, dihydroceramides, sphingosine. They can reduce inflammation through downregulation of multiple cytokine levels, and they can also reduce the level TSLP, a cytokine that causes pruritus. Still, they can induce synthesis of collagen and elastin, as we just saw. And most interesting, they can enhance the proliferation of dermapapilla cells and promote hair growth, as Habib shows with the use of the shampoos with the exosomes. So, as Habib say, we have many things we don't know still. But there are some things we do know. We do know that we must know the source of the cells, the efficiency of the exosomes isolation, We need to know if the conditions for storage and distribution are adequate. We need to have training. We need to do this. We need to be here. We need to share information. We need to share experience. And we must continue to come to these meetings to follow the continuous research and development of this area that's very, very fast moving. Thank you very much.